This is the first podcast. It deals with atherosclerosis or hardening of our arteries. The second podcast will reveal the truth about cholesterol. And the third will discuss what we can and what we cannot do to decrease our risk of stroke and heart attack. There are two terms that have been confused. The first is arteriosclerosis, which is the increased thickening and stiffness of the walls of our arteries due to hypertrophy of the muscle cells and breakdown of the elastic layer. And then there's atherosclerosis, which is the build-up of cholesterol beneath the inner lining of our arteries. These terms are often confused in the medical literature. We will use the term atherosclerosis. If you have a look at this picture, it's of a normal artery. You can see there's a lumen, that's where the blood flows.
The lining of the inside of the artery is called the intima, and this is a very specialised group of cells that are a little bit like Teflon. They help the blood flow smoothly through the artery. Just inside the intima is the internal elastic lamina
that expands and contracts with each heartbeat. Next, there is the media, which is basically connective tissue and muscle. The outside layer is the adventitia, which is a bit like leather, a very stiff coating of the artery. In this picture, we see the progressive changes that occur with the development of atherosclerosis. The first slide shows a normal artery. The next slide shows a little bit of cholesterol beneath the inner layer of the artery, and then the next two slides show a build-up of that cholesterol, progressively leading to more narrowing of the artery. This progressive accumulation of cholesterol in the wall can lead to either complete occlusion or it can rupture so that blood clots form on the inner surface of our arteries and break off to cause stroke and heart attacks. The current opinion is that atherosclerosis is due to a combination of ageing, inheriting a bad gene, smoking and obesity with its complications of high blood pressure, high cholesterol and diabetes. The problem is that atherosclerosis commences decades before we develop any of these so-called risk factors, and it occurs in people without any of these risk factors at all. This is putting the cart before the horse. This is not to say that blood pressure, high cholesterol and diabetes do not exacerbate the atherosclerosis. They do, but they cannot be the primary cause. So let's look at the evidence that justifies this statement. The very earliest changes of atherosclerosis have been detected at autopsy in premature babies and infants. Every individual over the age of 3 has the early stages of atherosclerosis, and this evidence comes from autopsies on young people who have died of accidental deaths. In the autopsies performed on US Korean war soldiers, there was severe atherosclerosis in the arteries to their heart, and in some cases the arteries were completely blocked. These soldiers were in their early 20s, and yet they had completely occluded arteries. What this study showed was that the angle that our arteries branch at is critical, and if it's greater than or equal to 80 degrees, we are much more likely to get atherosclerosis building up at that site. Now, who hasn't known someone who was perfectly fit and healthy and they suddenly died of a massive heart attack or stroke? As many as 25% of patients admitted to hospital with heart attacks do not have any of the so-called risk factors. Atherosclerosis can be detected in the arteries to the heart in almost half of us who don't have risk factors. So, what initiates the process of atherosclerosis? The evidence points to the fact that it is the physical damage inflicted throughout our entire life by the repetitive pounding of our blood vessels with each heartbeat. Every single one of us has repetitive pounding of our blood vessels with each heartbeat. This physical damage is exacerbated by high blood pressure, smoking and diabetes. Although cholesterol builds up in the walls of our arteries, there is strong scientific evidence to say it is not the primary cause of atherosclerosis. Every part of our artery is bathed in exactly the same level of cholesterol, and yet atherosclerosis only occurs in certain sites, and that's where the wall is subjected to high pressure and turbulence. There are two arteries that don't normally develop atherosclerosis, and yet they are bathed in exactly the same cholesterol-laden blood as the arteries that do develop atherosclerosis. One artery is the pulmonary artery that takes blood from the right side of our heart to our lungs. It is under very low pressure, but if we develop a condition called pulmonary hypertension, the pressure inside this artery increases and atherosclerosis develops. The other artery is the artery behind our breastbone, the internal mammary artery. This is used frequently for coronary artery bypass surgery. If we are born with a stricture of the main artery of our body, the aorta, called coarctation, and if it isn't repaired early enough, then the internal mammary artery is subjected to very high pressures proximal to the stricture, and it can completely occlude. The pressure inside our arteries also increases with increased blood volume that occurs with obesity. In morbid obesity, there can be as much as an extra 2 to 3 litres of blood in the blood vessels that were not designed to take that amount of blood. Further evidence comes from what happens to our veins. They also are bathed in exactly the same blood containing exactly the same amount of cholesterol, and yet they don't develop atherosclerosis. But if we take those veins, for example, out of our leg, and anastomose them to the arteries of our heart for bypass surgery, or anastomose an artery and a vein together to form a fistula, for example, for renal dialysis, then the veins are subjected to increased pressure and they develop atherosclerosis. When veins are used in bypass surgery, within 1 to 3 years there's already evidence of atherosclerosis, and they can occlude after 5 to 10 years. That's why most bypass surgery these days uses the internal mammary artery, or an artery out of our arm called the radial artery. Now, let's look at some of the other myths regarding atherosclerosis. It's not a disease of modern society. And yet the massive increase in the number of strokes and heart attacks since the middle of the 19th century gives us the impression it is. Atherosclerosis has been found in the ancient mummies of Egypt, Peru, Native Americans, and the hunter-gatherers from the Aleutian Islands. Severe atherosclerosis was found in the mummy of the morbidly obese Lady Di in China, dating back to 200 BC. The 5,000-year-old Utsi Iceman, found in the Alps between Austria and Italy, had severe calcification of his arteries, indicating severe atherosclerosis. He died of a stab wound at the young age of 45. He had an abnormality on chromosome 9 that predisposed him to premature atherosclerosis, and a number of his relatives have since been found living in Switzerland. In the third talk, I will discuss genes that we inherit from our parents and their influence on atherosclerosis. Atherosclerosis is not unique to humans. Sylvia Sykes has studied the animals of Africa, and Herbert Fox has studied more than 7,000 animals in the San Diego Zoo. They found atheroma identical to that seen in humans in many different animals and birds. The changes were less severe than we see in humans. The atherosclerosis was seen in meat eaters and non-meat eaters or herbivores. There was one very interesting observation, and that is in birds. Birds have a heart 1.5 times the size of other animals relative to their body weight. And very severe changes of atherosclerosis affects the arch of the aorta in birds. This is the site where the blood is pumped directly out of the heart and it hits the wall in the arch of the aorta. Now, the origin of the lipid or cholesterol hypothesis as the cause of atherosclerosis dates back to 1913. Lieutenant Colonel Nikolai Anishkow, a researcher in Russia, published his study on feeding rabbits massive amounts of cholesterol from egg yolks dissolved in sunflower oil. And he said it caused droplets of fat to accumulate in the walls of their arteries only after a few months. This lipid hypothesis was not accepted until the mid-1980s, when drugs that lowered the level of cholesterol were shown to reduce the risks of heart attacks and strokes. But these studies didn't prove the lipid hypothesis. They simply showed that lowering the cholesterol decreased the risk of heart attacks and strokes. This would be like saying that ulcers in our stomach must be due to the acid in our stomach because the symptoms settle with antacids. This was one of the proposed causes of peptic ulcer until Barry Marshall and Warren Allendale in Perth, Australia, proved it was due to a bacteria called Helicobacter pylori, for which they won the Nobel Prize. Barry Marshall had to drink the bacteria to give himself an ulcer to convince people. So Anishkow's study has misled the world for over a century. The many scientific facts, including extraordinary evidence from Anishkow himself that justifies what sounds like an outrageous statement, will be revealed in the next talk, The Truth About Cholesterol. So the disease, atherosclerosis, is initiated by physical damage to our blood vessels. And when the inner lining of our blood vessels is damaged, this allows cholesterol to build up inside the walls of our arteries. But don't despair. There is much we can do to reduce the severity of this atherosclerosis and decrease our risk of heart attacks and stroke. And this will be discussed in the next 2 podcasts.